Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
Hey everyone, and welcome. So today we're tackling pre-diabetes. But what if I told you that everything we thought we knew about it, that it's just a little warning sign for diabetes, is actually dangerously outdated? Let's dive into why the latest science is completely flipping the script. This one sentence right here, it really gets to the absolute heart of the issue. For way too long, getting a pre-diabetes diagnosis felt like a yellow light, right? Hey, you better watch out kind of moment. But the science is telling a much more urgent story. It's not a waiting room at all. Exactly. That's the million-dollar question, isn't it? If prediabetes isn't just some harmless layover, then what is it really? And maybe more importantly, what are we supposed to be doing about it? Okay, so to really get this new way of thinking, we have to first break down the old one. The whole idea of prediabetes being just a borderline lab result you check again in 6 months, that's fading, and it's fading fast. And the reason is simple. The damage isn't waiting around to start. It's already happening. This is what is so critical to understand. These aren't just risks that pop up after you're diagnosed with diabetes. Nope. This damage is happening right now during the so-called pre-diabetes phase. We're talking serious stuff like cardiovascular disease, chronic kidney disease, cognitive decline, even fatty liver disease. This makes it crystal clear. Pre-diabetes is an active disease state, not some passive warning sign. All right, so if the old label is broken, what's the fix? Well, it's this concept called staging. Instead of a simple you have it or you don't diagnosis, staging gives us a much richer, more detailed picture of what's really going on with your metabolic health. This slide just lays it all out, doesn't it? On the left, you've got that old one-size-fits-all label that misses so much of the story. But on the right, you see the real power of staging. It actually looks at the underlying biology, like how healthy your insulin-producing beta cells are, to create a totally personalized picture. And that helps doctors create a plan that's actually right for you. And this, right here, is the bottom line. Staging isn't just some fancy academic idea. It's a real, practical tool. It answers the questions that actually matter to you and your doctor. How far along is this really? And how aggressive do we need to be about it, like right now? Okay, so let's actually walk through these stages together. I want you to think of it like a journey, a map of your metabolic health. Knowing exactly where you are on that map is the absolute key to changing your final destination. Now, this might be the most eye-opening part of this whole thing. Stage 1 is when all your standard lab work, your fasting glucose, your A1C, it all comes back looking totally, completely normal. But here's the kicker. Normal doesn't always mean everything's okay. See, under the surface, the engine is already starting to strain a little. Your body's ability to pump out insulin is subtly dropping off, and that first quick response to a meal isn't quite as sharp as it used to be. Your body might be working like crazy behind the scenes just to keep those lab numbers looking good, basically masking the real problem. This is just a perfect real-world example. On paper, this guy looks totally healthy, but the clues are there. That fatigue after he eats, the fatty liver, his family history, all of these are signals that he's in stage 1. And you know what? This is actually the safest, cheapest, and most effective time to jump in and make those lifestyle changes count. Okay, now we're moving into stage 2. This is what we would traditionally call pre-diabetes. At this point, your lab numbers are officially outside of the normal range. And let's be clear, this isn't a pre-disease anymore. It's a full-blown disease state, and it's got real, tangible consequences. The urgency here is real. The damage is already systemic. In stage 2, we can actually see the beginnings of damage to blood vessels, to the kidneys, the eyes, the nerves. Your risk for a heart attack or a stroke is already higher. So no, this is not a waiting room. It's more like an active fire burning inside the body. And here's another really important scenario. This woman is a classic stage 2 patient. Given her whole history and that lab work, just telling her to change her diet and exercise more might not be aggressive enough. This is where staging is so powerful. It helps doctors decide if earlier, stronger interventions, maybe even medication, are needed to slam the brakes on progression. And finally, we get to stage 3, which is an official diagnosis of type 2 diabetes. But, and this is a huge but, this is not the end of the road. In fact, the very beginning of stage 3 is actually a massive, massive opportunity. They call this the critical window. Think of it as a golden opportunity. By hitting it hard in these first few years, with things like rapid weight loss and powerful medications, it's actually possible to preserve whatever insulin-producing cells you have left, and that can dramatically increase your chances of long-term remission. You see, timing is absolutely everything. Now here's another really important piece of the puzzle. Not everyone moves through these stages at the same speed. There are some really key differences between people who progress slowly over time and others who progress much, much faster. This table just breaks it down perfectly. Fast progressors, they tend to be younger, have more of that central or belly fat, and a really strong family history. You can even see it in their blood work. Their A1C climbs way faster year after year. Knowing which camp you're likely in helps figure out just how urgent the intervention needs to be. And this is where modern tech like continuous glucose monitoring or CGM is a total game changer. A standard A1C test gives you one number, an average over 3 months. It's like a single snapshot. A CGM, though, shows you the whole movie, all the dangerous spikes after meals, the swings overnight that are accelerating damage. It gives you a much, much clearer picture of your actual day-to-day risk. So, after hearing all of this, the big question is, who really needs to grab onto this proactive approach? Who should be raising their hand and asking their doctor, hey, what stage am I in? Well, this slide pretty much lays it out. If you see yourself in any of these groups, if you have a history of gestational diabetes, or a condition like PCOS, or a fatty liver, or a strong family history, then just waiting around for your lab numbers to cross some arbitrary line is a losing game. For these groups, being proactive isn't just a good idea, it's essential. So really, the big takeaway here is this. We need to completely shift how we think about this. The goal shouldn't be just to delay a diabetes diagnosis by a few years. The real goal should be to preserve your underlying metabolic machinery, your beta cells, your insulin sensitivity, for as long as humanly possible. That is what true prevention looks like. And we'll just end on this really powerful clinical message. It just perfectly sums up everything we've been talking about. The best opportunity for a healthier future is when we act early and we act decisively, reframing prediabetes not as a waiting room, but as the single most critical window for action we have.